Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. If you don't know this amazing face, this is the wonderful Dr. Sarah Swift. I have coerced her into my office willingly, maybe, depends on the day, because the Super Bowl brought up a really the Oscars brought up a topic for us, and I think you might know where we're going, but we want to talk about the raw, pun intended, realistic, what happens to you after you've given birth vaginally and you're at home now. Like, did you know you were going to bleed? You did. No,
you know,
some don't.
Maybe. So what happens is that you are going to push somewhere between 5 and about 10 pounds out of your lady bits. And in that process, there's a few things that happen. You can have some tearing. Majority of first-time moms have at least some tearing, even second, third, fourth-time moms. And that can cause some amount of discomfort. You also have big sort of scab in your uterus where your placenta was. Remember, your placenta is like yay big. You like placentas. I hand you placentas.
You do.
I take care. You take care of that.
But it shrinks back down, and so the whole inside literally is a scab, like a healing wound.
Right. So it will continue to bleed for a few weeks to up to 6 weeks is normal. So therefore, there's going to be some stuff that comes out. So the Oscars brought out this lovely commercial that they did not air because it was too offensive.
Mothers raged.
there were cars being burnt. But I think it brought a good point about what is postpartum recovery. They are marketing this new product that has not been seen before. It is a little bit on the pricier side. So instead of doing that, I brought some things along that may be super helpful. And some that you may actually be able to bring home from the hospital.
And I think some people don't even realize the stuff that you get in the bag of the hospital, you bring home. You're not stealing it. It's not like the hotel where you're like, I'm stealing the soaps.
Like, you don't get an extra bill for it.
No. Take it home.
If it's in your room, we can't reuse it. So whether it is the Perry bottle, that little squirt bottle, like that, you can take that home. If it is the pads on the toilet, you can take those home. If it is the Tux hemorrhoid pads that they've given you, you can take those home. We don't want them. We're just going to toss them.
The reusable mesh underwear?
Take those.
Take them home.
Yep. You can wash them. I may have come home with a few pair, but...
There's no judgment.
No, not at all. The first thing that I brought here with me is ibuprofen. It helps for a few things. So one is if you have a tear, that helps with that, and also with cramps. So especially if you're breastfeeding, there's going to be some cramping associated with that. I think it gets worse with subsequent babies.
Sure does.
So scheduling ibuprofen, usually a fairly good idea. It is not constipating, which is also a concern of mine. So that is a big favorite of mine. And then the next product is lidocaine spray. Now, a majority of hospitals will give this to you so you don't actually have to pick it up. In the Frida kit comes a foam that is just lidocaine, so it's nothing special. But this one, you literally just spray it down there, and it numbs it up and makes it feel a little bit better. You can't overdo it. So if it hurts,
good to know.
Spray.
Okay.
That's the other one. And then hemorrhoid pads. So all this is witch hazel. It is great and soothing and can be used for many things. But these are just pads that you can line your sanitary pad with, and they will help soothe your bottom and some hemorrhoids, which some of us may or may not have had.
It has happened.
So that's that.
And it's normal to get hemorrhoids.
Nope. They usually go away. And if they don't, we have people for that. And then, you're going to laugh at me.
What? Man.
Depends.
Yeah,
Okay?
I don't want to mess up my underwear, and the mesh ones ran out. Of course I'm going to be in Depends.
So, Depends are actually fantastic for the first few days. Or adult diapers, whatever you want to call them, for a few reasons. So, one is that there's no sliding. They don't go backwards and forwards. And then they don't leak. They come in different colors. They come in black, and they come in this lovely pink that I have here. So I think these are super helpful. They come in different sizes.
They do try to market, like, postpartum, like, there are different brands out there that try to market towards, like, wear these for postpartum, but depends.
Right.
So just so you know, so you don't get hung up on what is what.
Right.
But it is.
So all it is, it's legit it's underwear and sanitary pad all put together, and sometimes you may leak a little urine when you sneeze, cough. things like that. That is normal for up to 6 weeks. Some of us continue to have that,
Then that's a
forever.
pelvic floor specialist.
But we have people for that too.
We have people for everything.
But it is super helpful, especially the first few weeks, because things leak, you sneeze, so this catches urine, lochia, which is the bleeding after you have a baby. So those are super helpful. And then the last thing that was in the Frida bag was ice pads. There were 4 of them in there. So caution with ice. Ice is only supposed to be held on for 20 to 30 minutes, and there's supposed to be a barrier in between, because otherwise you can actually freeze your bottom. You can get ice crystals in your parts, which then hurt when they melt. So the hospital will give you some. If you still need ice at home, what I like doing, which is a super easy, cheap thing. This is a really big diaper, but that is what we had on hand. So
That's how we do it.
If you grab a newborn diaper and you open it up, here are the tabs, and you just separate this part. There's a, you can see in here, and if you put half a cup of ice in there and kind of squish it down here, and then you just put that in your sanitary pad or your Depends or whatever you may pick, it actually will melt, and then it inside of the diaper will absorb that, and there's no leaking.
Genius. We call them diapersicles.
Nice. If you wanted to prepare before baby, you can make padsicles. Have you made those?
Yeah.
So those are fun. All it is a sanitary pad. You open it up, and you can put 2 tablespoons of witch hazel and some aloe, and then you roll it back up, put it back in the cover, and then you put it in your freezer, and then you have them for when you come home.
Yeah.
Baby shower games or something like that.
Something fun.
Put your friends to work.
But it's realistic that, like, we really applaud Frida for talking about it and really bringing it to light, and that exactly was a great depiction of what it kind of looks like. It's not everyone's depiction, obviously, but it started a conversation, and so we wanted to make sure that whether it's you ordering this box for your friends or doing a little more cost saving, for budget friendly people, there's now options.
Yes.
And that's what we're all about, is options.
Yeah. And I think most of us who saw that commercial, we kind of felt it.
We went back.
Yeah, it took me back.
Cool.
Never to be seen again, but it took me back.
So that's what it is.
We're here for you, and talk to your friends about what happens after delivery. Talk to your OB, talk to your doula. We are here. We will tell you the good, the bad, the ugly.
Sure.
Maybe things that you didn't think about, things that I actually didn't even think about. But if you have at least some of these, you'll feel a little bit better.
Awesome. Thank you so much. Have a good one, guys. Bye.